patients who had serious or recurrent or chronic infections were excluded, and so were primary or secondary immune deficiency. So, pregnancy, breastfeeding, known history of active cancer, active alcohol use, hepatitis C, hemoglobin less than 8, absolute neutrophil count less than 1.5. This was a statistical methodology which was used. And so what were the results? So we did 22 patients data. Mean age was 46. Duration of rheumatoid arthritis was like 11.7. There were 19 females and there were 3 males. They had concomitant illnesses also, diabetes, hypertension, osteoporosis, osteoarthritis. This was like past history, which was totally resolved. Cancer more than 5 years, which was also treated. Concomitant illnesses, concomitant medications in these patients. They had morning stiffness, so 95% of the patients were seropositive, 86% of the patients complained of stiffness, large joint inflammation was seen in almost 100%, and so was the small joint, and patients also complained of fever, there were some patients complaining of fatigue. This was administered as 1000 milligrams on day 1, and second infusion 1000 milligrams on day 15. Pre-medication and monitoring were done according to the protocol. These were the results. This was the baseline. We looked at the ESR. This was baseline 48.5. At baseline, the VAS, which is visual analog score, pain score, health assessment questionnaire, and DAS 28, which was our primary objective of measurement. And this is very nicely shown over here, in which we can see that ESR is shown in red, VAS in green, pain score in blue, and then we have HAG. And you can see that how the ESR from this downward trend at 6 months, and then VAS, again a downward trend, pain scores and HAG scores. So this is at baseline, and this is the downward trend at 6 months. This is 6 months. So, but we'll talk about this in our question answer session also, because some of them flare up at 6 months. So, after being in remission for a while. So, this is DAS 28 score, which was our primary objective to determine it at baseline, and at 6 months follow up, decline from 6.5 to 3.4, and that was pretty impressive. Then EULAR response criteria, which were good, moderate, and so we can see that in about 57% of the patients, we achieved moderate EULAR response, and 38% good, and none of them had, like, at 6 months not a good response. This is clearly shown over here. So joint improvement, again swollen joints and tender joints. This is again shown here that this was at baseline. This was the number of tender joints, number of swollen joints, and this is the way the number of tender joints and number of swollen joints declined from baseline to at 6 months. This was the p-value, and actually in our patients we are lucky there was no serious adverse event requiring hospitalization. There were non-serious events. Some patients complained of fever. There was one patient who developed dengue fever and he was withdrawn from the study. Actually, he just had received one infusion and he had dengue, so he was withdrawn from the study. Anemia, a patient with a headache, some patients complaining of dizziness, weakness, patient had a UTI which was treated, patient complained of oral ulcers which were also treated and responded. So the conclusion is that rituximab is an effective and well-tolerated biologic DMARD in Pakistani patients with RA having active disease despite treatment with conventional DMRs. We have to have them on conventional DMRs first, and that's what we do. But in early arthritis clinics, other things are being done, which we'll discuss in a minute. Limitations of the study are that it is non-comparative and it is open label. It's not a placebo controlled, and the size is small. The disease being very expensive, the medicine being very expensive, not everybody can afford it. So the research agenda for the future is what is the long-term efficacy and safety of rituximab? we should have our own radiographic data because it is clearly this image study.